This trial essentially looked at a question comparing two biologics regardless of the chemotherapy backbone. And the thought was that we had data that suggests that the biologic Bevacizumab, which targets a specific axis, the angiogenic axis, combined to chemotherapy in colorectal cancer improves outcome. We had data suggestive that Cetuximab, which targets actually proteins or receptors specifically located on the cancer cells, EGFR, combined to chemotherapy also improves outcome. But there has never been that comparison, head-to-head comparison of could it be that one of these biologics would be superior to the other? Would that move Cetuximab to be used more commonly in the first line combined to chemotherapy versus what is our standard right now, the VEGF inhibitor, Bevacizumab. And so that's the basic question of looking whether we're going to actually induce a survival outcome by moving one biologic versus the other. The study essentially was looking at an outcome, a superior outcome with Cetuximab versus Bevacizumab. As it stands now, the results of the study suggest that there is no difference in the survival between the two. And essentially the way I would interpret that study is that it's a negative study, because the goal was to show superiority with Cetuximab versus Bevacizumab. The fact that the survival is about the same and the progression-free survival is about the same, that suggests to us that essentially there is no advantage of moving the EGFR inhibitor Cetuximab to the first line at this point of time. Now, mind you that one of the complexities of the study is the fact that the chemotherapy backbone was one of choice, meaning that folks that would use preferentially FOLFIRI versus FOLFOX would have the choice to do that. With time, we learned that perhaps FOLFIRI is a better backbone to combine with the biologics, and so that blurs a little bit the results of the study, and it appears that perhaps the FOLFIRI component of the study may do a little bit better, but that's pretty premature at this point of time.